For most people, volunteer hours are time to give back to the community, right? It's usually a cause we don't always have time for as we work our regular 9-to-5 jobs. But one man in Boise has invested both his career and time outside of work for a worthy cause. Cody Wolf is a biomolecular scientist at Boise State University. He's researching how cancer cells react to proteins. Meanwhile, outside the lab, you can find him talking to our state lawmakers or congressional delegation about his cancer research funding and making healthcare more accessible. It's been his life for about a decade now. But now, his volunteer efforts are officially recognized by the American Cancer Society Cancer Action Network. Here's Andrew Barline.
Life inside the lab can be considered redundant, but hardly predictable.
Everything that we do is based on these cell lines.
Cody Wolf comes here daily.
All of these are breast cancer cell lines. So a patient who had breast cancer donated her cells, and we grow them up in a lab so that we can test anything we want on them.
Because the controlled variable tends to be resistant.
A lot of times our immune cells are tricked by the cancer cells to be used for them instead of against them.
So it's a protein that makes the cancer spread more quickly?
Yep. So it's a normal immune protein called a cytokine. During a regular wound healing situation, it's going to help you fight that bacteria and help you close those wounds. But when cancer cells use it, they actually manipulate that protein to help it move faster.
And the work in this lab, Cody agrees, is important.
A lot of prep.
Because biology is about real people.
When you're just pipetting all day, it might feel like it's not very important, but then you go and you listen to a cancer patient, or you hear how they did not get access to care because they don't have insurance. Well, how good is my drug if a patient can't get it? It's not good at all.
Cody joined the American Cancer Society Cancer Action Network nearly a decade ago.
And I was really interested in the policy side of things because it's really where you make a change in cancer patients' lives, implementing policy to give them access to better treatment, increase cancer research funding. All of that comes through our federal government and our state government. And so that's what ACS Can does. I received the Young Leader Award at our National Leadership Summit in Lobby Day last year. It was really nice because Idaho doesn't get a lot of recognition. It's a hard state to push policy in some cases, and we work really, really hard. And so I felt like it was more of a team win than it was a personal win. We also fight really hard for access to care for patients, both federally and also in the state level here with Medicaid expansion that was passed in 2018. That was a really big thing that ACS Can was a part of.
Cody, he's part of it all, in and out of the lab.
To end cancer as we know it for everyone.
And his predictions, ambitious.
So I don't think there's going to be one cure for cancer, but I do think there's going to eventually be many, many cures or treatments that make cancer so much more easy to deal with.
This award is handed out annually to a state volunteer, and as you heard Cody say, it feels to him more like a team award, though he is happy to see progress move forward in the state. And then this scenario, Brian, he talked about, he feels they've had a lot of progress moving forward, kind of talking in generalities, but Medicaid expansion seems to be the big thing that really kind of hanging their hat on that they found success with. And he was seemed a little surprised they were actually able to do it. Obviously, a lot of groups working together on that piece.
Well, there's a lot of groups working against that, even to this day, who would say that was the downfall at this point and a detriment to the state of Idaho. Yet, cancer touches everyone. And so what he's doing is obviously going to affect those people that are also saying, well, we shouldn't have done this, shouldn't have funded this.
He was talking about a campaign that the organization did, I think it was called like 1 degree or 1 degree of separation, right? Maybe you don't have cancer. The chances you know someone who does or know someone who knows someone, it's like 100%. Like I don't know anyone who's not affected in one way or another.
All right, good for them. Thanks, Andrew.